taking testosterone gels, creams, or shots is going to slam the brakes on your fertility or sperm production factory. And it's basically, in most cases, going to come to a complete halt. So listen up, if you're on TRT or considering TRT, and you're also considering having children anywhere in your lifetime, whether that's in 6 months or in 10 years, you can't afford to ignore this specific thing. So today we're going to cut through some of the myths, and I'm going to break down the science of why TRT acts like a male birth control. And we'll reveal some of the strategies that you can use to potentially protect your fertility if you're considering conception in the near future. Hello and welcome. My name is Dr. Taranella, and this channel is all about helping you improve and optimize your health. Today, we're going to look at the question of low T and fertility, and we'll draw on my over 15 years of clinical practice and also some science and research to answer this specific question. If you're digging this kind of information and you want to continue getting videos like this, click on that like and subscribe to continue getting these videos. So here's the core issue. TRT feels great, makes you have a little bit more energy, focus, drive, libido, maybe even erectile function. And that's awesome for those that are having those issues. But introducing testosterone from the outside kind of does a fast one on your brain. Your brain is sensing how much testosterone is around, and when it senses the levels are high, it thinks the job's done. It doesn't need to produce any more testosterone. And so therefore, there's no need to send the signal from the brain to the testes to produce the testosterone. And those are the critical signaling hormones called FSH and LH. Without these signals, yes, you don't have any internal production of testosterone, but you also cut off your own natural production of the spermatozoa, which is critical for fertility. So this information is critical not to overlook if you're starting testosterone replacement therapy, or maybe even if you're already on it. And I hear from viewers on my channel from previous videos that I've done on this topic is that you're finding out that you have azoospermia, which is basically literally zero sperm after being on testosterone replacement therapy, maybe months, maybe years. But this is a common thing when you're on TRT. But a lot of people are completely unaware that this is occurring because, well, their doctor, or however they're getting the testosterone, did not inform them of this problem. And so understanding that risk-benefit ratio and how it actually works, and also some things you can do to intervene early, is what we're going to explore in this video before it's too late. So think of your testicles as a factory that make both testosterone, we can call that product A, and spermatozoa, you can call that product B. And the brain sends a signal, we can think of this as the manager to the factory, which are the testes, telling it to produce these two products. But testosterone is like flooding the market with product A from an external source. And so the brain is seeing all this product A and tells the testes, okay, shut down the factory, we don't need to produce anymore. When that happens, you're shutting down the production of product A and product B, meaning that, yeah, you don't need any more testosterone, but also not making the spermatozoa anymore either. So the main problem that I see with this is that people aren't adequately informed or explained the contraceptive effect of testosterone replacement therapy and fail to discuss full options for fertility preservation. As one viewer asked, should I be taking HCG? Obviously, I don't want to become sterile or have testicular atrophy. And these are valid concerns, and you want to discuss them up front before you're 2 years, 3 years into this process. So we have something known as the brain-testicular axis, and it's basically a feedback loop. It's a negative feedback loop. Your brain is consistently monitoring how much testosterone and also estrogen to a lesser extent, basically in your bloodstream. When the blood levels of the testosterone are low, it releases something called luteinizing hormone, as well as follicle-stimulating hormone, or FSH. Both of these are going to go down to the testes, and the luteinizing hormone is going to stimulate the specific cells in the testes called the Leydig cells to produce testosterone, and the FSH is going to stimulate Sertoli cells in the testes to make spermatozoa. When you inject or apply testosterone to your body, it basically stops sending the signal, the LH and the FSH, and the factory basically shuts down. That's fine in terms of testosterone, but in terms of fertility, if you want to remain fertile, not a great idea. In addition, there's also an important factor known as the intra-testicular testosterone levels versus the blood testosterone levels. So the testosterone concentration inside the testes themselves is much higher generally, sometimes 100 to 1,000 times higher than what's in your actual blood. And that's important and needed for sperm production. So TRT is going to raise your blood levels, but it's not really going to raise the testicular levels at all. In fact, because those luteinizing hormone levels are going down, it's basically going to be shut off depending on the dose and duration of your treatment. And because that's so low, it's not enough to fuel the testes to make the sperm. And I think it's important to think about this too in the context of a dimmer switch versus a light switch. The things in our bodies do not typically work like light switches, they work more like dimmer switches. Again, that's how the negative feedback and positive feedback systems in our bodies work. Depending on how much is there, it will downregulate or upregulate those signals for the LH and FSH. So while the testosterone replacement therapy is going to turn down the dimmer switch in terms of how much testosterone production is going to occur and how much spermatozoa production is going to occur, it doesn't usually cause a complete permanent sterility unless you are on testosterone replacement therapy for extremely long durations. And sometimes in addition, you have to be on extremely high levels. Sometimes these problems can also occur if you already have underlying fertility issues underneath even before you're on the testosterone replacement therapy. And so with that in mind too, it's important to recognize that just because you're on testosterone replacement therapy does not mean you can't have children. I've had many men in my practice get their wives or significant others pregnant while they're on testosterone replacement therapy. So if you're not wanting to have children, you need to keep that in mind as well. For the vast majority of people, you are going to have a lower effective sperm production. Now, it may not be zero, but it definitely can be. And I would say the base case when you're on testosterone replacement therapy is it's going to be much lower than when you're started. After stopping testosterone replacement therapy, your brain will typically restart the LH and FSH production again, restarting the connection down to the testes and increasing the intra-testicular production. Now, it's going to start on day one, but the full-fledged production of sperm is going to take several months, at least 3 months, to get the full amount of spermatozoa there that were there prior to being on testosterone. And in some cases, it can take even longer, 6 months, 12 months. And it depends on the duration of your TRT treatment, really. The longer you're on it, the more likely it's going to take a bit longer. And there's some other individual variabilities too, like it depends how much LH and FSH your brain is producing, and stress and things like that can impact that too, and sometimes chronic health issues. And so there's no guarantee that you're going to make a full recovery to your pre-TRT levels. But typically significant improvements are there, especially if you wait the 4 months or sometimes even 6 months. Now, we certainly can speed this up by taking things like Clomid and Clomiphene and HCG, and we'll discuss that here in a second. But the main thing is that if you stop testosterone replacement therapy and expect to see normal spermatozoa a month after stopping it, good luck, you're probably not going to see that unless you're one of those people that basically had normal sperm production anyways while you're on it. And that gets back to the dimmer switch versus light switch, is that you need enough of the spermatozoa per orgasm or ejaculate in order to sufficiently conceive a child. And so if your dimmer switch is turned down, it's going to take longer, going to take 3 months, 6 months, or potentially longer to get that full sperm production back to its normal levels. And so let's talk about some preservation strategies that you can implement if you're already on testosterone, but you want to maintain the sperm production at natural levels, or at least as high as we can get them. HCG is one of the most common things that are used. The price has definitely gone up with HCG, but you don't need a ton of it in order to maintain the production. And it mimics LH more so than FSH, and it directly is going to stimulate the Leydig cells to produce testosterone. And this is going to boost that intra-testicular testosterone production as well, helping to encourage that internal spermatozoa production. Clomiphene and N-clomiphene, these are two separate molecules that have pretty similar effects, and they're selective estrogen receptor modulators. So they basically trick the brain by blocking the estrogen receptor in the brain, detecting that there's too much estrogen present. And the key thing to know here is that the brain is looking for feedback from both testosterone and estrogen to determine how much LH and FSH to produce. So this mechanism is blocking the brain estrogen perception so that the brain is going to produce that LH and FSH to get more of the estrogen to be produced via producing testosterone, because the testosterone then turns into estrogen, feeds back to the brain. And sometimes, in some cases, using the Clomid or Clomiphene by itself is a better strategy, especially when you're looking to preserve fertility versus being on testosterone replacement therapy. Now, there is some differences in how these medicines work, and they don't work exactly the same. I would say the testosterone replacement therapy is typically a little bit more effective at relieving the low T symptoms, but it is a nice alternative solution when you're looking to preserve fertility or when that's in your future and really important. Also wanted to mention too, sometimes it's important to just take a pause while you're on testosterone so you can cycle in HCG and Clomid in some sort of rhythmic or consistent fashion while you're off of the testosterone. And that's just going to maintain the intra-testicular testosterone production and the spermatozoa production so that when you're ready to conceive a child, those levels are not starting from zero. In my patients, what I typically do is just have them use HCG on a regular basis once or twice a week to maintain those intratesticular testosterone levels and the LH levels to keep that spermatozoa production going. And when this is super important, then we will do serial testing of the semen and do semen analysis to make sure that there's plenty there and that they are active in swimming, there's no morphology problems, etc. And it's probably a good idea too, before hopping on testosterone replacement therapy, to get that semen analysis done, as well as looking at other health factors like, are you exercising? Are you getting good quality sleep? What's your stress management? All these things can feed into how much LH, FSH your brain is producing to make sure that your testes are getting the right stimulation to make enough of the sperm so that you can actually conceive a child. And that's where it's important to recognize the incredible sensitivity of these brain feedback mechanisms, and that introducing external hormones can have somewhat predictable but sometimes unpredictable downstream effects. And understanding how these things work is going to give you leverage in how to intervene when you're having problems. Make sure you bring it up to your doctor early and often throughout your conversations when you're going in for your visits, and making sure they're aware of just how important this factor is for you and where you're at in the cycle. As you get closer to actually wanting to conceive, we're probably going to change your treatment plan a little bit, or at least encourage some of that, depending on, again, what the importance is, how long you've been trying, and sometimes you have to tweak things to get the most out of it. A baseline semen analysis is always great, but if you haven't had this, then we need to see where things are at now, especially if you're currently trying to conceive. We may dial back the testosterone dose, dial up the HCG dose, try and find a balance between making sure you have enough production and enough symptom control so that things are not feeling crazy in terms of how you feel, but also able to manage the fertility side of things. Sometimes another option too is just banking your sperm and using the in vitro fertilization option that some couples opt to use. But I think overall it's about having a frank conversation about what your goals are, and having careful monitoring along the way is going to ensure you get the most out of your testosterone replacement therapy and your fertility options. Just a quick note too, I do have a guide that I made on testosterone replacement therapy that goes into some of the nuances on dosing and fertility and symptom control and things. It's called Mastering Your TRT, a guide to thriving on testosterone. You can find a link to that in the description down below. So here's some key takeaways to consider with testosterone and fertility. First thing to know is that TRT is going to naturally suppress your internal testosterone production as well as your sperm production via those negative feedback loops. Think LH, FSH, or product A, product B. Another important caveat too is it's also going to lower the intratesticular testosterone production, which is important for actually producing the sperm. So if you don't have enough testosterone inside the testes, you're not going to be able to produce the sperm that you need, even if there's enough stimulus there. And so that's where the LH and FSH come in hand here. TRT, of course, acts like a male contraceptive, and recovery is possible after stopping, but it definitely isn't guaranteed, and it takes a more deliberate approach in most cases. Sometimes I've had cases where patients have conceived even though they were on testosterone replacement therapy, but I would say that's the exception and not the rule. You can always go with preservation options like freezing your sperm, but I think keeping the regular feedback going, that positive feedback where you're either taking Clomid or HCG to stimulate the testes, to make the testosterone, to make the sperm, is the best option. I would say this is one of the most impactful and yet often under-discussed consequences of testosterone replacement therapy. So don't forget to discuss this with your TRT specialist. If you're thinking of having children, bring that up early and often. Hopefully this video helps you better understand how TRT can affect your fertility and what to do about it. If you have questions, please drop them in the comment section. I'm happy to answer your question. If you want a more nuanced, refined answer, or you just want to support the channel, consider joining the membership program, and I'll have more time and attention and be grateful for your support. Now, one question you might have after looking at this video is, how long does it really take for fertility to come back after stopping TRT? And you can find a nice detailed discussion on that right here.